Croeso. My name is Alison Cooper. I'm a Senior Clinical Research Fellow at Cardiff University and one of the Associate Directors of the Health and Care Research Wales Evidence Centre. I'm going to talk through a little bit about the Evidence Centre, how we work and the types of evidence that we can deliver, and then also how stakeholders can submit a research question to the Evidence Centre and what we mean by a good research question. So, the Health and Care Research Wales Evidence Centre was established in April 2023 to conduct rapid, relevant and rigorous evaluations to inform evidence-based decision-making in Welsh Government, the NHS and Social Care Wales. So, a big ask, but we do have an experience in this area. So we were set up in the same model quite rapidly during the COVID-19 pandemic as the Wales COVID Evidence Centre. And we operated in this form for 2 years, and in that time conducted over 50 studies, with over 20 of them referenced in Welsh Government policy papers. So we then became the Health and Care Research Wales Evidence Centre in 2023. We're funded for 5 years under Welsh Government, and our remit's now broader. It's health and social care, so it's a lot wider. We have attached with this document an information leaflet which tells a little bit more about the Evidence Centre with some helpful links to some resources as well, and there's also a link to our website here as well with more information. So this is what we look like. We are certainly an all-Wales organisation. We're led by a small operational group between Cardiff University and Bangor University. So Professor Adrian Edwards at Cardiff University is the director. We work really closely with our public partnership group of 10 participants to make sure that the public voice is heard within all of our research projects. But the main bulk of our work is done by our 5 research partner groups. So I'll talk through them all in turn. We've got one in Cardiff University, an evidence synthesis group. So they look at the international literature, so all of the studies that are relevant to a certain research question, and find them all, bring them all together and synthesize them to present findings that are relevant to a Welsh audience. Our team in Bangor University do something similar, but they also have health economic expertise, which can be really helpful for questions related to costs. We have a similar team in the Public Health Wales Evidence Service and also in Health Technology that also conduct these evidence reviews. And then a team in Swansea University. So this is slightly different. This is our Population Data Science team with access to the SAIL data bank. And they can do anonymised linked data studies, really relevant to the Wales context. We also have links in our strategic advisory group with other research centres across the UK to make sure that we're not duplicating, and also internationally, for example, the Cochrane collaboration. So it's really important for us as an evidence centre to work with our stakeholders. And what we mean by our stakeholders is those decision makers in health and social care. We really want to establish a work programme that addresses the most important policy and practice needs and is most likely to achieve change. So we can only do that when we work directly with our stakeholders so that we understand the decisions that they need to make and how us delivering that evidence can help with that decision making. So we work with colleagues in Welsh Government policy groups, in NHS Wales and in social care. This is a bit of a busy slide, but I think it's helpful just to understand how we work in the Evidence Centre. So, as I've mentioned, it's so important for us that stakeholders are involved throughout our process, from submitting those questions to being involved with the research project, for meeting those project teams, really being careful that the evidence we deliver is useful to them, that we don't go off on something that's interesting or nice to know. It has to be helpful to their decision making. And also at the end, to help get those findings out to practice and policy. Any questions that are submitted go through our prioritisation process. I'll talk through that in a little bit more detail, but we have 2 main work programmes. So our evidence synthesis is the main bulk of our work, and then our primary research work programme. Our evidence synthesis, we deliver different products depending on the timing and the needs of the stakeholders. Our rapid evidence summary can be conducted in 1 or 2 weeks, but this is very high level, so it's just looking more at titles and abstracts and trying to bring those together, more of an annotated bibliography. The main bulk of our work is either our rapid evidence maps, which for a broader topic where you're trying to understand the extent of the evidence in that area, can map the evidence in that area, and our rapid reviews that then, once you've found specific evidence in an area, really synthesize it, brings it together. So that's our rapid evidence review. And those are conducted in usually about 3 or 4 months, along the lines of an abbreviated systematic review. For our primary research, we do have our anonymised linked data studies, as I've mentioned, but also we have got some capacity for some smaller qualitative studies, so interviews or focus groups to understand the perceptions of participants. But what's also really important to us is our knowledge mobilisation phase, so getting the evidence out to the people that need it and making sure that it is impactful. So for knowledge mobilisation, it's getting the right information to the right people at the right time in the right place. As I've mentioned, so from stakeholders being involved from submitting the questions, but also during that research phase, getting the findings out there, and then impact later on. We have done an infographic which just highlights sort of the expected time commitments. We know that everyone's busy and it can be hard to attend meetings, so we do value stakeholders' time and keep this to a minimum. But in general, we ask stakeholders to meet with our study teams right at the beginning. So this would be an online meeting just of an hour, but just to clarify what the research question is and how the evidence is going to be used, so everyone is very aware of the focus. We then have another meeting quite early on in the process to clarify that we're going down the right direction, clarify the protocol, and that, again, we're still focusing in. Another 1-hour online meeting. And then a few months later, when we've got the findings, have another 1-hour online meeting to present the findings and think about the knowledge mobilisation plan and how to get the evidence out there. And then a few months after that, an impact meeting, just usually half an hour online, just to clarify if the evidence was useful and how it was used. Our primary research, that was more for our review methods. Our primary research can take a lot longer, so these meetings are spread out over long periods of time, 6 to 9 months or sometimes over a year. And also we ask our stakeholders if they can communicate via email if there's a specific query from our study teams that can just help quicken up that process as well. Okay, so what does a good research question mean for the Evidence Centre? So as I've mentioned, this addresses a decision problem for a key stakeholder. So everything is interesting, everything is nice to know, but what we really want to understand is there a decision that needs to be made, and if we deliver evidence, can it help with that decision making? We need a really clear plan of how that evidence would be used. So whether that's revising a policy or an implementation plan, or in practice, how the programme is going to work, but how would that evidence be used? To help us do that, it's really helpful for us to have key information. So using the example of our evidence reviews, our teams search in the international literature for studies in that area. They really need to focus in to make sure they're finding all those key studies we need to see. So that might help us to understand the population. So we're thinking about children or adults or participants with a certain medical condition, for example. Is there a specific intervention of interest or a specific condition? And is there a key outcome that would really help with that decision making? This will really help the teams find the right information. For our research question submission process, we do have a formal call for questions every 6 to 9 months, and our Spring 2025 call is open at the moment. We have a deadline of the 28th of March 2025. We have an online research question submission form. There is a link in these slides, and there's also a link in the attached information. We can only accept research questions submitted via the online form, but we have found a glitch in that you can't save the information once you start the process, so we also attach an editable Word document so that colleagues can draft their responses, edit them, admit them, share with colleagues before you can do a copy and paste onto the online form. And how we prioritise the questions are the criteria in our submission form. We also have a quite a formal prioritisation and sign-off process. So we review all the questions within this 5-stage process. So initially with senior team members from the Evidence Centre team, just to check if it is a question that looks as though we would be able to address this in the Evidence Centre, and it's within the scope of health and social care. We've got good connections with the Welsh Government evidence team, so we would meet with them to make sure that we're not duplicating with work that they're already doing, and also they're really helpful to help us with the Welsh Government priorities. If there's certain questions that come through that we know are also policy priorities that might be then prioritised. Our partner research groups have got a wealth of domain and methodological expertise, so we share all questions with them, and also we include members of our public group as well to ensure that the public voice is part of our process. Our strategic advisory group is our UK-wide level of colleagues who again can check that we're not duplicating with work that's going on, but also they know that what we're doing, so that they're not going to do work that they know that we're conducting as well. And then we get sign-off with our Health and Care Research Wales oversight group. So this is what the online submission form looks like. It says the deadline there, the 28th of March 2025, and there's a big button with Start Now that you press to start. We do ask for the name of an agreed stakeholder, a key contact that we can contact. So we ask for details there and ask you just to tick the box to say that you're happy to be the named stakeholder and understand that you need to attend these online meetings. So this might not be you, it might be a colleague from your team with a bit more capacity to attend meetings, but a key contact that we can communicate with to make sure that we are focusing the research in the appropriate way. We then ask what your evidence need is, so trying to understand what evidence you require. We also ask if this aligns with Welsh Government policy and priorities. So it's really important for us that we do align with Welsh Government, so it's important for this to be indicated in this phase. Also to make sure that we're not duplicating with work going on, and there is an evidence need for work in this area. So if you can add in any links to any papers that clarify it's an evidence need, or how the evidence is going to use, or why this is a priority, that's really helpful for us to help with our prioritisation as well. Okay, so this next bit is really important. So how will the evidence be applied in practice and policy, and who will benefit? So it's really important to put as much detail in here as possible, because we really want to know that this evidence will be used and have impact, and that's how we prioritise. The next question is about cost and equity considerations, because we know that these are Welsh Government priorities. So if there are specific cost and equity considerations, it's helpful for us to know about these so we can help with our prioritisation. Our Bangor team does add an economic consideration paragraph to all of our rapid reviews, but if there were questions specifically about costs, then we might think about which team was best to address those. We also need to know timelines, so there's no point in us delivering some fantastic evidence after the decision has been made, so it's really important that we understand when you need the evidence by, so that we can make sure that it fits with everyone's timeline. So this call closes at the end of March. The prioritisation process will take until mid-April, and then these questions will be taken onto our work programme from the end of April onwards, probably over the next 6 to 9 months. So if your decision needs to be made before April, for example, then it's probably not going to be within the timeline of our work programme. So the next question can be a bit tricky. This is where we start to ask a little bit more detail about the evidence need to turn it into a research question. So we often ask, what's the population of interest? Are we talking about children or adults or certain conditions? Is there a specific intervention, or is there a specific outcome of interest? But I would just say as much detail as you can is helpful, but don't worry, because we know that this is tricky. This can be really hard, and we do definitely help with this phase. And that's when the stakeholders meet with our study teams very early on in the process to clarify what is the research question. We often use PICO, but there are other tools that can be helpful with this process. But for PICO, we look at the population, as I mentioned. So for this broad question, understanding the challenges of the NHS in the future, it was really helpful to use this tool to develop that research question. When thinking about the population, we focused on an adult population. Instead of intervention, we looked at different types of long-term conditions, and we named all of those. And then we compared Wales to the rest of the UK and more internationally. And then as an outcome, we were focusing on the forecasted prevalence and incidence of these long-term conditions. So, diolch yn fawr. Thank you very much. There's a link there to our report, which might be helpful with examples of our work. If there's any questions, you're very welcome to email us, but hopefully you found that helpful and you're keen to submit a good research question to the Evidence Centre. Diolch yn fawr.